Bom dia, pessoal. Sejam todos muito bem-vindos. Muito obrigado a quem já se conectou aqui no nosso webinar. Eu sou José Fernando Dantas, coordenador de acesso a mercados aqui da Abimo. Hoje nós temos uma continuação da nossa série de acesso a mercados, com foco no setor de de dispositivos médicos no Quênia. Eu vou estar coordenando as nossas atividades durante essa manhã. Vamos contar aí com a participação de parceiros brasileiros e quenianos que vão apresentar detalhes sobre o mercado, de dispositivos médicos lá no Quênia. Essa é uma atividade que dá continuidade a uma série de ações que fizemos em parceria com a Embaixada do Brasil em Nairobi. Desde o ano passado, nós tivemos a oportunidade de participar da então Medic East Africa, com um stand institucional. Vimos ali uma grande demanda por produtos brasileiros. Decidimos então aprofundar o nosso entendimento sobre esse mercado, sendo aí o Quênia um grande potencial e hub de exportação na região. Então, a gente continuou essa atividade em paralelo à nossa segunda participação na feira, que esse ano vai se chamar World Health Expo Nairobi. Então, mais uma vez, a BIMO, por meio aí do nosso projeto de exportação, vamos ter a oportunidade de participar, dessa vez como expositores, nessa grande feira, sendo a principal ali da região, em parceria com a Embaixada do Brasil em Nairobi, o Ministério das Relações Exteriores. Recentemente, a gente divulgou para vocês, empresas associadas, um estudo de mercado sobre o Quênia, com informações aí relevantes sobre comércio exterior, o funcionamento do sistema de saúde, registro de produtos. Então, caso vocês ainda não tenham acesso a esse conteúdo, podem solicitar aqui a BIM que a gente vai divulgar para vocês. Como de costume, eu queria passar só algumas orientações antes da gente começar. Essa, como eu comentei, é uma continuidade de uma série de webinars que a gente realiza mensalmente aqui na Abimo. Caso vocês tenham perdido alguma outra edição, basta acessar o nosso canal do YouTube, Brazilian Health Devices, e lá vocês vão poder encontrar todas as outras edições que a gente já realizou. Então, não se preocupem, esse conteúdo também está sendo gravado e assim que a gente finalizar, vamos disponibilizar no nosso canal, juntamente com as apresentações que a gente vai enviar para vocês por e-mail. Eu vou começar a falar em inglês aqui, muito por conta da participação dos nossos parceiros lá do Quênia. Vou cumprimentá-los, agradecer a presença, mas para que vocês saibam, durante o nosso webinar hoje, parte das apresentações será feita em português e parte em inglês. É, mas, enfim, sem nenhum prejuízo de conteúdo, a gente vai estar também compartilhando com vocês apresentações assim que possível. Peço para vocês manterem microfone e câmera desligado durante o webinar. A gente vai ter uma sessão de perguntas e respostas ao fim da última apresentação. Então, guardem as perguntas para o final. Caso prefiram, pode me enviar no WhatsApp ou também aqui pelo chat. E quando for o momento, eu vou pedir para vocês se manifestarem para apresentarem suas perguntas. Bem, let's start talking in English just to make sure everyone is understanding. I will I would like first to take this opportunity to thank the embassy, name of the BMO. The embassy, it's been a partner, a very important partner for us here in Abimo. As I said before, this is a continuation of actions that we've doing and performing with alongside with the embassy. Last year, we had the opportunity to participate in Medic East Africa. This year, we will be back, but now with the pavilion, we will have four companies exhibiting in this trade show. For us, it's a great honor to be there again. Kenya, it's been a very important market for our companies in Africa. So we are very glad to have you here today. I would like to uh, well thank the Ministry of Health, the Pharmacy and Poison Board, Apex Brazil and Funding who accept our invitation and who will be here presenting and sharing information with our associates. Thank you again for accepting the invitation. Well, Guilherme from the embassy. Guilherme is the head of the trade promotion section of the Embassy of Brazil in Nairobi. He will be doing his welcoming remarks, and then we will properly start our webinar. Thank you all again, and I wish you a great webinar today. Guilherme, please.
Hi, good morning, everyone. Good afternoon for those in Kenya. As Jose said, my name is Guilherme Agostini. I'll be continuing here in English so everyone from both sides can understand. I'm the head of trade promotion here at the Embassy of Brazil. It's a position I've only taken recently. I've been here for 6 months now, but it was already to see that there is much to be done in bringing Kenya and Brazil together in the commercial section. As Jose said, this action that we're doing here is only one initiative in a series of initiatives we have been doing in conjunction with ABIMO. Last year, I wasn't here, but Nelson and Brian, who are analysts at the trade promotion sector, were, and welcome Jose to the then called MEDIC East Africa, which is the biggest trade fair in the health sector here in the region. And this year it changed its name. Now it's World Health Expo, but we're expanding our participation. Instead of just having the institutional stand from ABIMO, we're going to be bringing 4 companies here. And we hope we can do great business to find great opportunities for Brazilian companies. And well, I will not be promoting myself here. I want to give the word to Brian Nelson, who, as I said, are 2 analysts are at the trade promotion section here at the embassy. They'll be presenting a bit on the macroeconomic environment in Kenya, Brazil and Kenya trade relations, and something that is very important to us as well, that we also like to highlight is the role the embassy can play in helping the companies approaching a new market, approaching an existing market. And well, we're here to help. But now I'll give the word to Brian and Nelson. Please present yourselves.
Thank you, Guilherme. So let's start with our presentations. First, Brian Kimani and now Nelson Omalu, who are technical assistants, technical trade advisors at the embassy. Please, guys, feel free to start.
Hello and good afternoon. Boa tarde, those in Brazil. For us here in Kenya, we say good bon dia, those in Brazil. For those in Nairobi here, we say good afternoon. Yes, so my name is Nelson. I'll be guiding us through this session, the first part of the session, and then my colleague Brian will also guide us on the second part of the session. So feel free, you're welcome. We hope you get some information, what we have prepared as SECOM. Thank you. So SECOM here, we have prepared just information for you to get to know more about Kenya. Just get to understand what Kenya is. Of course, Kenya, we identify ourselves as a gateway to opportunities into Africa. And so we identify ourselves with this because we are not only a promising country, but we are also the growth driver for the region. We attribute this to our strong economic performance, which is driven by youthful and very skilled population. And of course, increasing government investment in key sectors. This one you will see, of course, even with the other presenters, I believe, as they show their presentation. Kenya is strategically located in the region. We have the main port of Mombasa, which serves the internal parts of the region. Most of the landlocked countries of Uganda and Rwanda and the rest of the region. We have good infrastructure. Of course, the airport, you will see it when you come to Nairobi. It enhances our regional connectivity a lot. And also Kenya is known for its very strong diplomatic partnerships, which of course one of them is with Brazil, which also enhances our presence globally and in the region. We will, of course, regarding our economic performance, you can see, of course, during COVID, we had governments made very strong decisions to encounter the effects of COVID. And so we had a very high growth post-COVID in 2021, economic growth rate, but then this growth rate slightly slumped in 2022 to 4.9%, as the economy was stabilizing a little bit. And then now it got stable from 4.9 to 5.7 in 2023. And now last year, 2024, the Kenyan economy had a slight slump, of course, but still a growth of 4.7, which is a very strong economic performance. We consider Kenya as one of the fastest growing economies globally. You can see the growth rate we've seen in 2022 of 4.7%, 2023 of 5.7%, and even the 2024 one, which was still strong. Despite the reduction in the growth rate, it still had a very strong presence. And this can be attributed to factors such as the slight slump can be attributed to factors such as the government making decisions, fiscal decisions, and also inflation, and the shilling also was slightly affected by dollar decisions. Our GDP is a good one at 16.2 trillion shillings, converted at the rate of 129 shilling per US dollar to $125.6 billion. That is the gross domestic product of Kenya. Now, if you look at that comparison with the other regions, we can see the East African community, where Kenya belongs, is one of the strongest performing regions globally, which grew at 5.4% in 2024. The Sub-Saharan region grew at 3.8%, and you can see the global economy was at 3.2%. This tells you that the growth rate in Kenya, the economic growth rate in Kenya is, it consistently surpasses the regional and the global averages. And this shows Kenya to be a very resilient country and has very great potential as our regional hub. The Sub-Saharan Africa, you can see where Kenya belongs, grew by 3.6% in 2022. 3% in 2023 and 3.6% in 2024, still slightly higher than the global averages. So the global economy grew by 3.5, 3 and 3.2 in 2023 and 2024. So you can see Kenya, which falls in the Sub-Saharan Africa, still has a remarkable economic performance and makes it a very great potential for the region and of course for Africa as a whole. In terms of sectoral contributions, you can see the service sector is the biggest contributor to our economic performance, contributing 55% to the GDP. So you can see that pie chart. Service sector contributes 55%. Agriculture contributed 22% last year. Industry contributed 17%, and the other sectors contributed 6%. Of course, health sector is cross-cutting, service, agriculture, and all that. But health, as part of the service sector, of course, it contributed a lot. Also, the industrial sector, where, of course, we expect a BMO to have a little bit of an input, also is a major, health sector is a major contributor. Directly, health contributed directly as a sector. Health contributed among other sectors, giving around 2% to the GDP. Kenya is strategically located, as we had said earlier. You can see the map of Africa. The eastern side, the eastern part of Africa, that is where Kenya is. You can identify you can locate Kenya from the arrow, the red arrow. It points to where Kenya is, and you can see it's directly from the Indian Ocean. So consignments can come. So as we said, there's the Jomo Kenyatta International Airport, and we also have Mombasa, at the port of Mombasa, where consignments can dock into the region. So Kenya, of course, because of that, it serves as a logistical hub for Eastern and Central Africa. And you find that there is a major demand for medical services in the region. So Kenya serves as a major tourism destination for those of us who are coming within Africa itself, and more so in the Eastern Africa region. You find many people come to Nairobi for medical care. The main entry point into Kenya is the port of Mombasa, as I said, at the airport, Jomo Kenyatta. And then it has the inland container depot, and also this facilitates trade with the neighboring countries, which are also landlocked. So this strategic advantage solidifies our role, the role of Kenya as a gateway into the Eastern African region, most of the landlocked countries. You can see from the map, we have the port of Mombasa. There's an infrastructure. There are some infrastructure that lead into the region. There's a standard gauge railway from Mombasa all the way to Nairobi. You can see that big red line. It shows the standard gauge railway. And then there in Nairobi, there's the inland container depots, which of course serve as a clearance. Of course, if you can't clear in Mombasa, you can clear in Nairobi for those consignments that are meant to be sold locally. And also for those who intend to still transport their consignment, you can transport by rail to Kisumu, or even by road even to Uganda. There's the old standard railway line, the old railway line, which goes all the way to Kisumu. And then from Kisumu, there are other port services that you can get to transport your products into Uganda and even the other side, other parts of the region. So that shows the strategic location of Kenya. In terms of demographics, Kenya has a very youthful population. Actually, we know that 80% of the population is 35 years and younger. So this presents a mix of population where you can get a very youthful and very productive group of people. The current population is of approximately 53.3 million people currently. The last census was done in 2019, and in that year we were around 49 million people. So this gives us a population growth rate of 2% annually. With this population growth rate, you can of course estimate in the next 10 years we will be around 63 million people. So there's that annual growth rate, which of course favors the demand for whoever would be considering this market. The most populous regions are around the major urban centers and agricultural regions. You can see Nairobi is the capital. At the centermost part, you can see on the map the red areas, the areas marked with red. They are the most populated areas. Nairobi is more at the center. It is the capital and it has around 4.9 million inhabitants. Now, Nairobi in itself as a city, but we can talk of the Nairobi metropolitan region, which serves also with other neighboring counties. That gives you a population of around 11 million inhabitants, that metropolitan region. The entire central region, you can see marked with red and some shade of red. So that makes Nairobi a very important hub. So other populous regions, of course, are spread within the urban and agricultural areas of the country. In terms of our bilateral relations with Brazil, we started our relations in 1964. This one has helped to strengthen economic ties, of course, between the two countries. We have various partnerships, especially in cooperation in various sectors. We have agriculture, health, trade, education, and many other sectors. Recently, we saw a sign of renewed commitment from the governments, from Kenya also and Brazil, by the visit of the Kenyan minister who visited Brazil recently. And in fact, there were some signings that were done. And so this tells you that there's a lot of commitment from these countries. In terms of our foreign trade, Kenya's trade volume in 2024 was approximately 28.83 billion USD, with exports of 1.1 trillion shillings, that is around 8.61 billion US dollars. Out of this, Kenya exported to Brazil around 1.24 million dollars. Well, a small amount, but then I believe with such engagements with the embassy, this one can still grow. Our imports of Kenya from the world was around 20.22 billion But out of these 20.22 billion, we can see there's still room for growth, because from Brazil, we had around $93.5 million being imported from Brazil into Kenya. So that shows there's a lot of room for growth for advancing this kind of engagements that we have between these two countries. Our trade deficit, of course, Kenya is perennially net importer. So we had a trade deficit of 11.61 billion. Our main import sources, most countries that the biggest importers, the biggest markets for our imports are usually China, UAE, India, US, Uganda, and Japan. Most of the imported commodities include food commodities, mainly cereals, and then telecommunication equipment, some medical equipment, of course. They also form part of the imported products. Machinery, aircraft, those ones, the main products that Kenya imported. Our volume of trade data, you can see, as we have said, the trade deficit, we suffer perennial trade deficits. This is mainly because most of our products are manufactured products, and they come value added, so it increases the price of such commodities. In terms of our medical devices imports, which I believe our representatives from the Ministry of Health will still talk more about this. Most of our imports valued in 2022, that's the last data we could get, around $33.1 million annually. And we have limited domestic manufacturing capabilities, so we get reliant on imports. Major import sources include China, Switzerland, France, India, US, and Germany. So the imported equipment included diagnostic equipment and surgical equipment, patient monitoring equipment, and the rest. At this point, I would let my colleague Brian to proceed with the next part of the presentation. Thank you.
Hello, everyone. Can you hear me? Thank you, Nelson, for the introduction. Bon dia, good evening. Can you hear me?
Yes, Brian.
All right. So without much further ado, we begin with the most fundamental question, which will be which segments of Kenya's medical sector has Brazil managed to capture for the period 2022 to date? And to answer that question, we'll have to dive down into the profile of exports from Brazil. And from that, I need to mention that this is basically from a supply point of view. And by no means should this be interpreted to mean that this is the actual demand that we'll get from the Ministry of Health. This is just what Brazil is partaking in the Kenyan market. So the first area is in the diagnostic equipment. There's a presence of Brazilian supply, especially for high value, low volume capital equipment. Here we're going to focus on X-rays, apparatus, and ophthalmic devices. Then the next sector is in the high volume consumables. Here, the focus will be the recurrent nature of these consumables, which we're going to talk about more in detail in the next slide. And finally, it's the dental sector, which combines the two aspects we have talked about, the equipment and the consumables, as we shall see going forward. So drilling down to the diagnostics equipment, as I alluded to, is a sector that is categorized by low quantities, and they are often in single units, as we shall see here in the first chart. We are going to see from the radiology apparatus as seen here. Now, I want you to take a keen look at the FOB values. The FOB values are increasing, and it could give the facade that, again, Brazil is exporting more products here in Kenya. But I want you to look at the supply curve. We are exporting 2 units annually in 2022, 2023, 2024, and now in 2025, only 1 unit within that cluster of that NCM for radiology apparatus. This is something that we're going to see throughout all the medical equipment. It's something that is going to be very common, that the FOB value is very high, but when you consider the quantities that are being exported, or in other words, the quantities that are coming here into Kenya, they're very limited. But on the flip side, Brazil has managed to carve itself a market in the eye segment, where we're seeing a positive trend, where we're seeing the supply is increasing. We have, like, in 2022, 1 unit, 8 units, 20 units. and you can see the FOB values are also increasing. So this is a market that Brazil has been able to supply and carved for itself as a market. So there's a shift in that trend. And before I move on to the next slide, I want you to take a keen note of this year, 2024 and 2024 for diagnostic equipment. Is an anomaly that is going to be explained in the next slide. Moving on to the consumables, this is, as again, it's characterized by high demand and low unit cost. Just to explain that, we are going to look at the most lucrative product that Brazil is supplying in the Kenyan market. This is the probes, catheters, and stems. As you can see, the supply curve is increasing. The quantities that we are that Brazil is bringing to Kenya is increasing, as well as the FOB values. This is something that we would want to see, and it's something that we are looking forward to. And this is one of the markets that is flourishing, and this is based on the fact that there is recurrent demand for these products that are being used. The same applies to ophthalmology equipment, that apparatus for compensating illnesses. We can see the trend is the same. The FOB values are increasing, and with it also the supply curve is also increasing in terms of units. You can see them down below here and also on the chart. Before I move on to the next slide, I made you take note of the 2024 year as the year that equipments were actually being imported here in Kenya. Now, the reverse happens in 2025, where we're seeing now the consumables are also increasing in that year. So many questions may arise as to, is it a change in the focus from Brazilian suppliers or from equipment to now consumables, or is it a response to demand or any other factor that could be actually contributing to that? But basically, that is the picture in terms of consumables. Now, in the dental sector, it exemplifies the two-tier system that we have observed, the equipment and also the consumables. From the equipment, we are going to focus on instruments of dentistry, dental x-ray apparatus, as well as dentist chairs and parts thereof. When we come to consumables, the key products that are being exported here are acrylic artificial teeth, dental fillings, and some x-ray films. Moving forward to the dental equipment, again, a similar pattern as we saw in the diagnostics equipment, large one-off purchases. These cuts across in all equipment, whether it be dental or any other medical equipment, that large volume, the same pattern is seen to be evident as illustrated here with the x-ray, dental x-ray apparatus. Now here, I want to just focus on two things. These two bars are on dental x-ray apparatus, and the year is 2023. Again, I'm going to make you take note of the years because they speak of something in a bigger sense. And the last two bars here, they speak of the dental chairs and parts thereof. As we can see, 2023 is a key defining year in terms of dental sector, and we're going to see that throughout in the next slides. The same applies when we talk about instruments of dentistry. Again, we see a similar trend. The FOB values are high, but when you look at the supply of the product versus the FOB values, especially in 2023, which is what I want to focus on, we see that the quantities being exported are high, but they are of lower value. And then this can be explained by the fact that this is an NCM classification which incorporates so many other aspects in there. But again, you can see there is an anomaly in the year 2023, as we have seen here for those equipments in terms of the dental sector. And we're going to see that in the consumables market. Now, dental consumables, again, similar to what we saw in the overall consumable market, is a very steady, and there's a high demand for dental filling products. Again, the positive trend that I always want to see. We see that the supply is increasing in terms of quantities, and as well, we can also see that the demand is also increasing. Again, take note of the year 2023, an anomaly here. So I've got to pose a question thereafter. Maybe the Ministry of Health will help us understand from a demand point of view. Then again, another product that is also best performing by Brazilians is in the acrylic teeth, artificial teeth. That the quantities are increasing, and as well as the FOB values are also increasing. So, in a nutshell, what are the notable trends and observations that we can pick up from that small presentation? First is that Brazil's medical device market here in Kenya is a two-tier system where we have the market for capital medical equipment and the market for consumables and tools. The second trend is that the market for capital goods is very volatile and sporadic, and the market is lumpy. It's characterized by lumpy, high value, low volume purchases. The competition here being for large, infrequent tenders from major hospitals, suppliers, and government procurement agencies. When you talk about the consumables market, is the most reliable because of the recurrent nature of the disposable medical equipment, and therefore underlying a market for routine healthcare supplies. This is a market that Brazil is best performing, as we have seen in the previous slides. To conclude, how can the embassy support in any of the ventures that any entrepreneur is planning here in Kenya? So we start with linkages that we help with facilitating linkages with government entities, ministries, investment promotion agencies like Ken Invest, as well as regulation agencies like the Poisons and Pharmacy Board. Then we do trade facilitation, and one way of doing trade facilitation is hosting such webinars and also fast tracking on agreements that are pending and yet to be implemented, just making sure that there's movement and there's no bottlenecks within the supply chain. Finally, we also support market access facilities. These incorporate like hosting the facilitating the trade fairs like the World Health Expo that you're going to partake later in the coming month, and also supporting inbound and outbound missions, among others. Now, to conclude, this is the SECOM team, as we already know, and thank you so much for being here. Karibu sana.
Thank you. Thank you, Nelson and Brian, for sharing details and information about the Kenyan market, macroeconomics, and also some information about trade balance of our sector. Continuing with our program, I would like now to invite Mr. George Gaturra, which is data analyst from the Ministry of Health of Kenya, who will be sharing with us an overview of the Kenyan's health sector. Please, Mr. George.
Yes, good afternoon, everyone. I hope you can hear me.
Yeah, we can hear you, but your camera, it's off.
Okay.
Yeah, and now full screen. Let's see.
Yes. Okay, good afternoon, everyone, and good morning for those in Brazil. Okay, my name is George Gatuha. I work at State Department for Public Health and Professional Standards at the Directorate of Health Standards, Quality Assurance and Regulations, specifically at the Division of Health Monitoring and Evaluation, Ministry of Health, Kenya. I'm going to give an overview of the Kenya health system, the structure and progress like I was requested. And before I start, I acknowledge efforts by Nelson and Brian. I've seen they have done a lot of statistics on issues to do with medical devices and applications. And I'm happy to hear that they know a lot out there. Thank you. So I'm going to introduce the Kenya health system. And the Kenya Constitution provides that every person has a right to the highest attainable standard of health, including emergency, the strategic direction for health sector is defined by the following policies and plans. One is Kenya Health Policy, that is from 2014 to 2030. Kenya Health Sector Strategic Plan, 2023 to 2028. Kenya Vision 2030, Bottom Economic Transformative Agenda, that is the agenda of this current government. So the Constitution established two-tier health systems, that is national government and the 47 county governments. The national governments deal with policies, health policies, national referral hospitals, capacity building, and technical assistance to the counties. The county governments are responsible for managing their healthcare in their counties. And then second slide is on Kenya's health systems overview. The Kenya health system is organized into CAF levels, Kenya Essential Package for Health levels, 1 all the way to 6. 1, 2, and 3 is on primary health care. 1 is on community health units. 2 is primary health care. And level 3 is the same, but with additional of maternity and nursing homes. Then we have level 4, which is the primary referral units. Level 5 is the secondary referral units. These are county referral hospitals and large private hospitals, providing specialized care, including surgery, inpatient, and diagnostic. Finally, we have level 6. Again, they provide highly specialized care, such as advanced surgery, specialized services, diagnostic services, and treatment for medical complex conditions. The primary healthcare has been strengthened through implementation of primary care networks to fast-track progress to universal health coverage. Community health has also been strengthened with coverage of community health workers now at almost 100%. Then we go to health demographics. In Kenya, life expectancy is 66.8 years, which is a significant increase from 47.2 in 2010. Immunization coverage, Penta 1 coverage is at 87.4, Penta 3 is at 76.8%, and full immunization coverage as at 2022-2023. The Penta 3 coverage is 87.4, and the full immunization is at 6.8. We have made significant progress in TB control with decreasing incidence and mortality rates since 2015, putting the country on course to meet the NTB milestones. However, NCDs are increasingly posing a major public health and economic burden. They are accounting to 41% of death annually. Facility maternal mortality rates, again, currently at 94. Confirmed malaria cases per 1,000 people currently is at 105. Road traffic fatality rate is at 8.6 per 100,000 people. General health status, you can see NCDs were the leading cause of death for above 5 years old for both male and female. The proportion of deaths due to communicable diseases was highest among those above 45 years and above. Among the under 5 children, communicable diseases were the leading causes of death, most likely due to diarrhea and pneumonia. NCDs also contribute a significant proportion of death under 5, and this is mostly attributed to neonatal causes due to interpretum delivery and prematurity complications. We move to population access to healthcare services. We can see the distribution of facilities across the country, and you can see there are disparities. And this is brought about by population density, private sector investment. They want to invest in places where their population is high. Healthcare workers, they also prefer to work in more urban areas as opposed to rural areas. Again, infrastructure also determines distribution of health facilities. And of course, finally, geographic disparities. Where we have low population densities, we expect to have low facilities. Then we move on to classification of health facilities. Like I said before, we have levels 1 to 6. And I've done an overview of facilities distribution. Currently, as per 2023, we have around 14,883 facilities. Level 2 facilities, there are 47% government, 46% private, faith-based NGO is 7%. Level 3 facilities, we can see GOK is at 48%, private is 44%, NGO is 8%, and level 4, GOK is 39, private 49, and NGO. You can see private sector and government are moving in tandem. Then we look at basic amenities, a measure of physical access. How do these facilities access various services? For example, reliable power source. You can see 89% of the facilities have a reliable power source. Reliable water source, mobile signal accessibility routes were available in 8 of every 10 facilities. Then we move on to national public share. The landscape of healthcare in Kenya reveals a complex interplay between public and private sector. You can see that in child illness cases, they are mostly done at public facilities. Caesarean section, that 4% is done in private sector. Institutional delivery is at 25% in private sector. Urban population mostly use private care facilities as opposed to public. Then we move on to health system performance. Health facility density is at 22.1 per 10,000 population. That is, there are 2.1 facilities per 10,000 population, which is still below our targets. Health workforce density, again, you can see 16.6%, not 16.6 per 10,000 population. Hospital bed density is again 18.1 per 10,000 population, which is again below the benchmark of 25. Then we look at critical care services. And you can see out of 12,375 health facilities assessed, only 22% reported that they offer critical care services. Only 22%. So there is 78% not providing the services. And in the whole country, there's a total of 779 beds, both in public facilities. Level 6 have the highest ICU services, while level 4 have the highest high dependency unit services across the country. Then we move to basic equipment between level 2 and 3. We can see that out of 172, there is only 107 weighing scale. That is about 2%. Then there is an examination coach covered with marking torch is 271, representing 7%. Overall, you can see there is a shortage of some of these basic equipment. And on average, availability of basic equipment was at 35% in level 2 facilities. Then we go to tracer drugs, pharmaceuticals. Availability of pharmaceutical services, it's at 57%. All tracer farms are at 6%. And all tracer non-farms are at 15%. Then we move to order fielded, that is health products and technologies. And you can see that the order field rates has risen from 51% to 64% in 2022-2023, compared to 2020-2021. So there is an increase of about 7%. Mean availability of medicine and medical supplies stood at 97% and 100% respectively. Only a third of health products and technology needs had budget allocation to them, leaving at 65% unfunded. Blood collection increased to 412,868 in the year under review, that is 2022-2023, compared to 348,507 in 2020-2021 financial year. Then we move to health financing. The trends indicate that domestic general health expenditure as percentage of GDP increased from 1.3% in 2000 to 2.1% in 2019. Current health expenditure per capita in US dollar has increased from 20.5 million in 2000 to 83.4 million US dollar in 2019. It is noted that there is steady progress in health prioritization with domestic general government health expenditure as a percentage of general government expenditure, rising 7.1 in 2000 to 8.3 in 2019. Then we move on to social health insurance. Again, we aspire to fully achieve universal health coverage. And therefore, the government established Social Health Agency in October 2024. And the aim is to provide affordable, accessible, and quality healthcare services to all Kenyans. SHA operates with three main funds: Primary Healthcare Fund, that is level 1, 2, 3, Social Health Insurance Fund, level 4, 5, and 6, and Emergency and Chronic Critical Illness Fund, which unfortunately is yet to be rolled out. Public sector support to private facilities. The government extends support to various private sector hospitals. And an example is what we have just said about universal health coverage. Patients are treated with or without providing money, and then they are reimbursed from SHA in support of universal health coverage. Public-private partnerships. Private sector provide equipment on lease to government facilities. Capacity buildings, various projects by GOK for capacity building. Regulatory frameworks, development of regulations to both public and private sector to ensure quality of service. Technological adoption of digital health technologies in both public and private hospitals. As an example, EACHIS. Then we move to emerging issues in healthcare. Some of the emerging issues are unemployment rates. We have a high unemployment rate in our country. Inflation is also a burden. Mental health issues. There's the increase in burden of mental health issues that results in increase in suicide cases, homicide, domestic abuse. Then we have climate change, which has resulted in the disruption of physical and social environment with frequent extreme weather events such as storms and floods. Again, these climate change issues affect the most vulnerable in the community. Then we move to how goods are procured in the system. In the country, we have a procurement. In the public sector, procurement is done through KEMSA, Kenya Medical Supplies Authority. They are mandated to procure medicines and medical commodities for public health facilities following Public Procurement Act. Again, there are other players which have emerged, like MEDS, who provide medical equipment and pharmaceutical products to the county governments and in private in general. Then we have the private sector. They are the regulatory compliance for private sector, the pharmacy and poison food, oversee medical devices requiring registration, import permits, under adherence to the Kenyan National Treatment System for private facilities and importers. I'm sure PPB are going to give us more insight on this. And then we have equipment support for counties. There is a national equipment service program that enable vendors to supply and maintain medical equipment for county facilities under a fee for service model. You don't have to put in any initial capital. And currently we have about 7 vendors who are selected between the 47 counties and the Ministry of Health. And in conclusion, I'm going to talk about HPTs. We want to operationalize HPT committee units across the 47 counties to strengthen capacity for HPT across all the 47 counties. We want to have a sort of multidisciplinary teams that are going to be looking at procurement so that we move in tandem. Health informatics, we envision to integrate Kenya Health Information System with key systems such as TB, Kenya EMR, ITIS, SHA, KEMSA, so that we have end-to-end visibility of health data from one station. Infrastructure and facilities, there's a need to identify and invest in facilities with poor infrastructure. Health financing, again, we are proposing that we increase the budgetary allocation to healthcare so that we can meet all our requirements. And that is the end of my presentation. Thank you.
Thank you, Mr. George, for the information shared. I'm sure everybody here is grateful for the quality of the information you shared with us. I already received some questions, but I will leave that to the Q&A sessions in the end of our webinar. Moving forward, I would now ask Mr. Eric Quintangala, Regulatory Officer from the Drug Registration Department, and Dr. Alan Kialo, Acting Head of the Trade Affairs Unit of the Pharmacy and Poison Board, PPB, which is the medical devices regulatory body in Kenya, who will share with us some insights regarding the process and requirements for registration of medical devices in Kenya. Please, Mr. Eric.
Thank you very much, Jose Fernando, for inviting me to talk about market authorization for medical devices and in vitro diagnostics in Kenya. Yeah, as you've been told, my name is Eric Tangala. I work at the Department of Product Evaluation and Registration, basically within the medical devices unit. So I will take you through this presentation quite fast. Then probably if there are any questions, we'll be able to answer them. Now, just an introduction, the Pharmacy and Poisons Board, this is the National Medicines Regulatory Authority in the country, yeah, which has been established by law, which is Cap 244 of the laws of Kenya. It regulates pharmacy practice and also all health products and technologies trade in the country. Significantly, it is there to make sure that there's safety, efficacy, and quality of medicines because we regulate medicines, food supplements, herbal products, and cosmetics, all chemical substances, especially for testing and the ones that affect the humans, and medical devices that include the ones that are locally manufactured, imported, exported, distributed, sold, or used in the country. So I will narrow my presentation to medical devices. And at Pharmacy and Poisons Board, we classify our medical devices based on risk And depending with the risk of the medical device at hand, then we are able to classify and ask for particular documentation as per the risk. And that one goes through risk classification of class A, B, C, and D as per international standards. And then we also have the in vitro diagnostics, the ones that are used for testings that are classified again as A, B, and C, depending with the risk, and also depending with other factors like invasiveness or non-invasiveness of the particular device. So in essence, there are registration requirements that we require from anybody who wants to import or manufacture any medical devices within the country. And they are normally found on our website. And if you can look at this one is just a page that I opened. Especially at medical devices, we have guidelines for registration of medical devices establishments, and then guidelines for registration of medical devices, including in vitro diagnostics. Now, these guidelines from our website will give you step-by-step application process and requirements that are needed when you want to register a medical device or you want to bring a medical device into the country. This one is a screenshot of the portal. This one is where we have any importer, anybody who wants to bring a medical device into the country to be able to register themselves. So this one, again, this is the URL that we normally use. And if you go to our website, you will also get it. We normally call it the Prince portal. So here is where you come, you open, and then you create an account. Requirements for the account, again, are varied depending with what you're bringing in. But for us, we'll just limit ourselves to the medical devices. It's primarily a very simple process because these are the parameters that we look at when you're registering a local technical representative who's going to be standing in for the sale and distribution of medical devices within the country. And you can see some of the requirements are quite basic because these are the ones that we need, like just the company name, certificate of the business registration, and then ownership type, company phone, demographics of the company, and then all that, plus the contact person, and then you open up your portal. So once you're in the portal, you are able to apply. You're able to upload any requirements, like if you need to trade in like a particular medical device, then here is where now you're going to come in, register it, and then once it comes to us, then we are going to do the screening and evaluation and make sure that you get the response within the required period. So this one is just a screenshot of the portal. Now, the portal on your side, once you register yourself, these are the parameters that you will see. And if you look at the third box, that is where we have medical devices. So if you want to register a medical device, depending with the class, here is where you come, where my cursor is. And then at times you may do a medical, you may want to do a medical device retention. This one is normally an annual activity whereby you retain the medical devices, showing us that you're still interested in trading with the medical device within the country. So you do a retention. And then at times there may be a variation, either a variation with the medical device, a variation with the aspects of the particular device or the functionality of the device, because like right now with technology, things are changing. So you can come and vary it here. And then once it comes to us, we will either approve or ask for more evidence. And then again, you may either want to vary the local technical representative who is selling or distributing your medical devices. Again, that is where you come. So the third box is the one that is dealing with primarily medical devices, but you can see the others as well. It's good to just know where you have your profile, the pharmaceutical products, herbal, if you're a transporter of medical items. Then we have blood and blood products, which I will talk about later, and then trade permit and others, either donation and cosmetics. And I think when we are here at this portal, I would also just want to mention, it is not part of the presentation, but I want to mention that when you're bringing in medical devices, there are 3 ways, or rather 4 ways that you can bring them in. One is the normal pathway whereby you register the medical device. The second one, it can be a donation that is coming from another country and it needs to be used in the country. Again, it can be registered. There's a donation pathway. And then there's also a parallel importation pathway that you can also use, and also unregistered pathway. All of them have their guidelines and different requirements so that you can use them anytime you want to import a product. So this screen, I put it here because I just wanted to give an indication of the medical devices and what classes they belong to, and what are the fee that accrue when you want to bring such a medical device. For example, when you talk about a class A medical device, which is the least risk, like cotton wool, urine collection bottles, hospital beds, those will include even clean gloves, things like crutches and all that. Those ones are class A, and we register them one-off registration that is $100 US. So as you go down, class B, which are moderate risk medical devices that may include catheters, tracheal tubes, syringes, needles. Those ones are classified as class B, and there's a one-off payment registration fee of $200 USD. So as you go higher, we have the class C, which have a moderate risk, including contact lenses for long use, and things like implants, things like blood bags, those ones then are registered as class C medical devices with their own requirements, and you pay $1,000. So for class C and D is $1,000. That is moderate and high risk for medical devices importation into the country. So once they come in, we do the evaluation. As per our service charter, it should take 24 hours, but 24 months. But recently, we just did an analysis. Most of them lie between around 70 and 90 days. That means within 3 months, at most, a medical device, you're able to register it into the country and also be able to use it. So these ones are just factors and terms that we use in classification. Apart from the risk-based, sometimes we also use the invasive and non-invasive terminologies, depending with the medical device, even if it is an invasive medical device, and depending with the term and the duration is going to be into a patient or a client, then the risk may go higher. And then we also have the active medical devices, the ones that use energy, like X-rays, some of them use electricity and all that. And then we have the exceptional classes, whereby we have the cleaning reagents. We also have some medical devices that have incorporation of animal or human cells, tissues, derivatives. So medical devices are divided into 2, whereby now we just have the normal medical devices, and then we have in vitro diagnostic medical devices. These are the ones that are used for testing. They may be used for testing at home or in the health facility. And again, it depends with the risk that is posed by each and every medical device. So in case the risk is localized around the patient who is using it, then those ones are classified as low risk. But if the risk is actually bigger than just an individual, it may cause, it has a public health impact, like for example, COVID testing kits, HIV testing kits, then Ebola testing kits. Those ones will go to a higher class that is class D. but the ones that have a lower risk, like let's say pregnancy test kits, blood sugar testing kits, those ones are Class A. So that is how we classify the IBDs. The rates again apply from $100, $200, and $1,000 for each when you are registering the medical products. So in essence, this one I just wanted to mention because I know this one will be trade oriented. Most of the items that are fast moving are normally between Class A and B. Those ones are quite fast moving, and you'll find 70% of our registration will lie between Class A and B medical devices. Because of their use, again, they are used at health facilities at a very high rate. You can imagine gloves, needles, syringes, dressing equipment, like surgical equipment, including forceps, kidney dishes, and all that. These are very fast moving medical devices, and they account for more than 70% of all the registered medical devices. So this one was just a snapshot. I will allow my colleague, Dr. Alan, to proceed on with the other section of trade. And then if there are any questions, we are going to be able to address them. Thank you, and over back to you, Fernandez.
Thank you, Eric. I believe now we can hear from Dr. Allen, the second presentation.
Good morning in Brazil, good afternoon in Kenya. Hope everybody can see the screen.
Yeah, it's not full screen though.
Yep, there you go. Is
Yeah,
okay
perfect.
now? Good. So my name is Alan Chalo. I'm the head of Trade Affairs Unit in Pharmacy and Poisons Board. The Pharmacy and Poisons Board is the national regulatory authority that is charged with regulatory oversight of health products and technologies in the country. I will limit my presentation to import and export control. There are other functions for the department or the unit, but I think for these purposes, we limit ourselves to the import and export control. Good. So the scope of this presentation is on medicines, conventional medicines, that is the human. We don't do vet, complementary medicine, herbal products, biological, biosimilars, and vaccines, the food supplements and borderline products, medical devices, which my colleague Eric has dealt on sufficiently, cosmetics, radionuclide and radiopharmaceuticals, blood and blood products, tissue organs, and excretion. So that is the scope of what is regulated currently by Pharmacy and Poisons Board. To delve into the import-export process, the entire process for us in Kenya is an automated system, which encompasses 3 government agencies in respect to health products and technologies. So we have the Kenya Revenue Authority, which uses the Integrated Custom Management System, the ICMS. Then we have the Kenya Trade Network Agency, which brings on board the trade facilitation platform. And now Pharmacy and Poisons Board comes in with its pharmaceutical resource information management system. All these 2-3 systems are integrated. So whereas you start your applications at the customs, Kenya Revenue Authority, your information will be transmitted seamlessly all the way to the Pharmacy and Poisons Board. The reason is initially, before the year 2014, there were no automations of such a kind, and therefore you used to have applicants moving to various government agencies to sort out and get the applications. But since 2014, we introduced a single window system, which brought all business community together with regulators into one platform, the single window, which currently we call the trade facilitation platform, and it linked the customs system together with the regulator system. So activities are done in those two systems, and we are able to facilitate import, export, and regulatory oversight of the same through the systems. The importations are done through the gazetted ports of entry, and we have around 11 or so ports of entry, and this is mirrored again as per the WHO GBT requirements that we should have designated areas for entry and exit of pharmaceutical and health products and technologies, because again, it is on those areas where we will put our human resources and other investments in technologies for adequate surveillance and testing of products when they're coming in or leaving the country. So majorly among the various ports of entry, we have the Jomo Kenyatta Airport, which I know our colleagues in the embassy alluded to. It has a high level of human traffic, people coming through the port of Jomo Kenyatta, but also equally for consignment. It also serves as one of the busiest, and it is followed closely by Kilindini and ICD in that way. The current statistics in respect to the products, the imports are at around 133 billion Kenya shillings. That translates to around $1 billion US. And the exports are at 17 billion, translating to around 132 million US. I was happy that this was reflecting in the previous presentation, and therefore you can see how the systems are beginning to communicate to each other. Of all that, items which are coming, you realize the pharmaceutical products, the commercial medicine products are taking a bigger chunk of it at 34%, and then they are followed by medical devices, which are taking around 16.34% of all those importations. Donations, which could either be both pharmaceuticals or medical devices, are taking around 14.66%. Then government supplies, and I'm happy our colleague from the ministry has shown you that aspect of government health facilities together with the private sector. So the products which are coming into the government supplies, they have their own pathway, which we give them, so that we also facilitate and we're able to monitor that space, what is happening. And we also have another category for bonded warehouse HPTs, which is taking around 2.8% of all those imports. And you would then wonder, what is what do we mean by the bonded warehouse HPTs or health products and technologies? As the earlier presenters have indicated, Kenya is a regional hub. If you want to get into other countries in the region, we are seeing a good number of investors pitching in Kenya, and we usually facilitate the operations through the special economic zones and the export processing zones, which are considered foreign in a way, and therefore goods, we allow these goods to come into the country, and these the investors then are able to look for the markets within the region, and this facilitates a quick turnaround time. If somebody has an order to Somalia, somebody has an order to South Sudan or DRC, then they pitch it here earlier as they try to see how best to transmit the same to those neighboring countries. Most importantly as well, we have a good number of humanitarian agencies stationed in Kenya. We have the MSF, Medicine Sans Frontiers, which is busy supplying the region. We have the ICRC, which is equally busy supplying the region in those war-torn areas. And we also have the IOM, International Organization of Migration, trying to also support the region. So you realize some of the vaccines used to people who are about to be migrated to other areas, the majority are assembled. I mean, they're brought here, put in those special economic zones or APZ, and when time is ready, then they're able to be moved to the other countries around where we are. Then we also have the promotional materials, health products and technologies, which carries around 0.06%. And I think you will understand, these are not for commercial purposes, but again, they will still carry a value for purposes of custom declaration. These are products which are coming for various exhibitions. Like now what our colleagues in the embassy have said, that there's that activity happening in October. So we facilitate such activities. We issue the permit, and we do this activity together with customs. Customs will give you a bond or a conditional approval, which we will use now to reciprocate as well, and give you, as the lead agency in health products and technologies, give you the same to allow you to bring those products for exhibition. And then we can agree after the exhibition, they go back to this country of supply or origin. But in case then they get a buyer, then you are expected to come and declare the same, and we register. They go the normal route of registration, as my previous colleague has indicated. So that provision is there, and we don't charge any fee when we are providing that facilitation. The next slide is the top import sources, and I think I also agree, my previous presenters have also indicated to it. We have 40% coming from India, around 9%, Germany, then China on 8%, then we have USA companies. Some of the medical devices is already been projected coming from the US government. Then we have the France market as well at 5%, UK at 4%, Belgium 2%, Sweden, Netherlands, and Pakistan, they are sharing at 2% of the entire imports in respect to all the imports are coming into the country. Our top export sources from Kenya to the other regions, Tanzania at 25%, then Somalia at 11%, and Uganda 10%, Malawi 8%, and Ethiopia at 7%. As my colleague has also alluded to, and you can be sure we didn't consult each other. I'm just surprised that then we are having a concurrence of the same commonly imported medical devices. It's just like he's indicated, the class A and B, the gloves, the syringes, the needles, the rapid diagnostic kits and IVDs, lab reagents, chemicals, controls and culture medias, laboratory wares and precursor chemicals. The only alert I will put for precursor chemicals, they take a different route. We call the illicit control pathway. A good example of precursor chemicals is like the hydrochloric acid, the sulfuric acid, the acetone, the toluene. These are products which have been categorized as precursors in the International Narcotics Control Board, and there's a strict way we usually monitor their movement into the country and their consumption. With that, then, how does the import happen? So I had already alluded, we have 3 government agencies which are involved to ensure that then you as the client are able to apply for your import permits and have your goods come in. So what happens is once the Medical Device Market Authorization Department has cleared you and registered you, they will give you what they projected to you. It's called retention. So retention is a communication to us as a regulator that you are in business and your product is circulating in the market. That vote, that fee that you pay for retention is used to strengthen the post-market surveillance activities. And therefore, what happens, we have a market surveillance department whose primary role is to be out there, get those medical devices, especially the consumables, the gloves, the needles, and similar other products, and test to ensure then that the quality is still maintained as was indicated at the time of registration. So that is the main reason why that retention is there. So once they give you that, then you are able to come and begin the process of importing and doing your business. So the starting point is usually the Kenya Revenue Authority, where you get the base document number, or what we used to call back then the import declaration form. Remember, this is an intention. You are telling the government, I intend to import these. So at this time level, they don't charge you anything. They allow you to proceed and make your intention. After that, that information is seamlessly transmitted to the single window, or what we call the trade facilitation platform. And from there to Pharmacy and Poisons Board, where now we are able to see your application. We assess it against what you've retained. And if everything is fine, we give it a clean bill of health and we allow you to do the importation. There is a fee you pay for the permit. We call it the service fee, which is about 0.75% FOB of the invoice value. So if the invoice value is $1,000, so it will be 0.75 divided by 100 times the $1,000, and then you can convert it. The system is able to convert it to Kenya shillings, so you can pay either the dollar or the Kenya shillings. So once that is done, the main documents which guide all those processes, my colleague has already spoken to about the medical device registration guideline. This is a picture of just the landing page of it, and it is available in our website. And we also have the import and export guideline for health products and technologies, which is also available in our website. And there it gives you the various requirements for the various types of permits. We have like 13 types of permits serving different cases. We have the commercial medicine permit that is basically for products which are going to be imported, the commercial medicines for the market. Medical devices is a different permit. Promotional material is a different one. Raw materials permit and packaging material for those who are intending to manufacture pharmaceutical products, finished pharmaceutical product, and finished medical devices. They also use that route because we have a few establishments which are producing medical devices. We have one in a special economic zone, and we have another one in a export processing zone. And we have another one just not in any of the spaces, but just doing the normal production of medical devices. So these people, when they are bringing those items to manufacture here, these products, we give them the permit for raw materials, and it has its own exemptions. They don't get those taxations as it were for the other items, which I will speak to later. Once that is done, as you do the importation, there is an item you need to be careful with, which is the East Africa Custom Common External Tariff booklet. We use a common HS code or common tariff booklet for the 6 EAC member states, the East Africa member states. We have a common tariff book which lists the various HS codes that are going to be used in the region and the attendant taxations which will attract for such kind of product. So it is very important when you are planning to do the imports, you are aware on this book and the tariff that relates to it, because it's the tariff is the booklet that the customs used to use it to make taxation on what needs to be taxed. So majorly now in pharmaceuticals and medical devices, they are in chapter 30 of that booklet, the EAC Common External Tariff book. You find pharmaceutical products in chapter 30. We also get a few medical devices in the same chapter 30. Just like you'll see in just a few minutes, you can see like now these ones. Now this is this is for organs. Chapter 3001 is for bloods and other organs. Then you will find chapter 3005, you'll have the wording, the gauze, the bandages, and similar articles impregnated or coated with pharmaceutical substances or up to forms for packing for retail sale, surgical, dental, or vet purposes. So the dressings are, you can see in chapter 30, we have surgical, sterile surgical catgut, and wound closure medical devices, dental adhesion barriers. So you can see this is chapter 3006, and you can see there's a column here for the unit of measure, and then this part gives you the likelihood that is going the likelihood that is going to be charged. So whereas the tariff book here will say it for years they have not proposing any taxation at this column, the governments have a leeway based on their interests and their protectionist practices to do any taxation on this part. And therefore, what happens every July when the budget is being read, that bill will always touch on these sections. And therefore, if you go to the Finance Act, it will give you the current position on the taxations on this column. And therefore you can, it's good because you can see the dental cement and other dental filing, bond reconstruction, first aid boxes and kits, and so on and so forth. They fall under that chapter. But you realize products like the hospital beds and hospital furniture, they will be in chapter 90 of the same tariff book. So when you get time, you can be able to visit and just acquaint yourself with that section. Chapter 30 and chapter 90, you'll find the medical devices in those two chapters of the East Africa Custom Management Common External Tariff Book. Moving further, there's a pointer that you need to be aware of, and this is on the pre-export verification of consignment before goods are shipped to Kenya. So this program of pre-export verification of consignment inspection is administered by a partner government agency called Kenya Bureau of Standards, KEBS. And what it does is that we have an MOU, and the resultant of it that it is happening is that at a time T, I can say we were not existing, so it were. So there needed to be somebody to just make sure that everything is under control, quality, safety, and efficacy-wise. And as the regulator, the Pharmacy and Poisons Board began to come up and grow, they have been seeded in ground on the same. So you realize now with time, we took over the entire pharmaceutical control and we do inspections both in foreign as well as the local part. And therefore, once we do the registrations of the pharmaceuticals and we do the inspections, then those products are exempt from any PVOC program. But now, since we don't do inspections for manufacturing sites for medical devices, then somebody needed to take that part of the inspection. We do registration, as my colleague has indicated, for the medical devices. But now when it comes to the foreign space, goods coming for inspection, medical devices coming from foreign space, they then have to be inspected. And KEBS, we agreed we have an MOU that for now, as we continue to increase on our numbers and capacity, they will be doing the inspections for us. So what they have done, the KEBS have in their website, we will be sharing this, they have divided the globe into various sections, and they have indicated, like you can see, I don't know whether it's very clear, but you can see they have divided countries into various zones and indicated who their inspectors in those areas are. Like you can see Brazil in point number 9. Brazil, the inspection is being done by SGS, and this is the goods are inspected before they come. So this, and you can see other countries. There's India, Pakistan, Sri Lanka, China. I can see United States of America and Canada. So the inspections of those medical devices are done. So what happens is once the permit has been issued, then the IDF is automatically, the import declaration form is automatically issued. And what happens after that, you will use that import declaration form or base document to schedule inspection with the SGS partners of KEBS. And then they will issue you the PVOC program, PVOC certificate that these products are of good quality, safe, and efficacy, and then they can be shipped into the country. They charge a fee on the same. It's available on their website, but the bare minimum is $250 on the minimum. But if the product is more than, I think around 250 or thereabouts, then there's a percentage now they begin using to calculate. With that, then there's also what they call destination inspection. There are countries, for some reason, KEBS has allowed, whereas the goods may not be inspected by the time they leave. For various countries, those goods will be inspected when the goods arrive in Kenya at the port of entry. And you can see some like the Nordic countries, the Middle East countries, the Maghreb countries, the North Africa, West Africa. So these countries, their goods are inspected at the port when the cargo arrives. The website for the PVOC program, we have put it down there for you to be able to just touch base with it and get acquainted. And in case of any questions, you can always reach out. Then we also have a program we call Recordation Program. This is by the Anti-Counterfeit Agency of Kenya. And what this program does is that they require recordation of intellectual property rights for imported goods as a trade facilitation measure. So what happens when goods are coming, the Anti-Counterfeit Authority will always charge you a fee for you, even as you provide these intellectual property rights and you file with them. So they charge around 2,600 Kenya shillings for every consignment. That translates to about, is it $20 or thereabout, $20 per consignment. These two programs have been contested initially, and the discussions are still ongoing, but the processes are ongoing. Like, for example, for the PVOC program, we were able to fight it off as a regulator because we said we are doing the complete cycle of registrations to inspections, and therefore there was no need of subjecting the pharmaceuticals to the PVOC program. But again, when it came now to medical devices, with our absence in doing inspections, then somebody had to do it. That there was a push by the overall government for that to be done. But what we are doing currently, there is a discussion around reliance mechanisms, where a product is registered in an SRA country, then we don't need to subject it to all these other activities of inspections, and even the registration would be faster, as my colleague had indicated. And therefore, when we concretize those discussions, then we also expect to do away with the PVOC program at a time T. We are not able to give you the certain period that will come, but discussions are ongoing because these are a discussion which has been there. It has been a pain point from the industry. It's a discussion that is ongoing on how we can do away with the PVOC program for medical devices. Equally the same, the issue for recordation program has also been contested by the industry, and the matter went to court, and the people who had contested it lost it, and the court upheld it. But within the government circles, again, the item is still under consideration, just to avoid and to ensure then we don't have double regulatory practices. So those are just the main items we wanted to pitch out, that in as much as you enter, then this is the process, but be aware of this so that you don't say this was not indicated when we went through the entire process and ecosystem. Having said that, my name is Alan. I sign off. Thank you very much. I'll be expecting and ready to take any questions. Thank you.
Thank you, Dr. Allen. Moving on with the presentations, I would like now to invite Adriano Azevedo from the Market Intelligence Department of Apex Brazil, which presents to us the business opportunities for medical devices in Kenya. Please, Adriano.
Good morning, good afternoon, everyone. It's an honor for me to be here this morning, participate in this webinar alongside the Brazilian Embassy, Kenyan authorities, and Brazilian companies. Today, I'm going to present the opportunity map developed by Apex Brazil. This tool was developed in Portuguese. It was specially designed, tailor-made for Brazilian companies, to find opportunities around the world. In this case, a specific Kenyan opportunities in medical devices. I'm gonna work directly on the tool, so we'll have two codes. The first code, I was deciding, I'm speaking English or Portuguese and this confusion, but we have two codes. The first one, I'm gonna speak in Portuguese, for Brazilian companies. And the second one, I'm gonna speak in English, and I think is gonna be good for everyone, okay? Now I'm gonna share my screen. Share the screen of the tool. Share, okay, and I think you are seeing now.
Sim, tá na tela.
Excellent. Ok, pessoal, bom dia, empresas brasileiras, sucesso aí nessa jornada, é o nosso desejo aqui da Apex, tá? Então, aqui está o mapa de oportunidades que o Dantas está compartilhando. Peço que o Dantas compartilhe o QR Code e o link para que vocês tenham acesso à ferramenta, tá? Essa ferramenta é desenvolvida na Apex com base em SH6. Adriano, por que não NCM? Porque SH6 é a visão de mundo das exportações. Vai estar um pouco agregado, mas funciona. Então, tu pega teu HC, teu SH6, teu NCM, corta 2 dígitos e aí você vai ter o SH6 e que você pode colocar aqui. A visão da ferramenta é uma visão por produto, né, por SH6, uma visão por grupo de produtos, por país e por UF. Também você consegue ver estados brasileiros. Por produto, você pode digitar tanto o SH, né, que a gente já vai fazer isso, ou então digitar o nome, né, o nome que você conhece, que é aí a ferramenta, porque nós temos temos o texto do SH e temos o código do SH. Então a gente vai começar aqui uma outra informação. O dado que temos, né? Então a gente realmente está olhando para o passado mesmo, porque os dados de comércio mundial estão fechados até 2023, logo a gente está com a versão já 2024, porque nem todos fecharam ainda 2024. Quando todos os países fecharem 2024, sai a nova versão 2024 do mapa de oportunidades, que deve estar saindo lá por volta de novembro. Vamos lá. O Dantas, né, sugeriu a gente selecionar 2 SH6 para a gente fazer essa simulação na ferramenta. E aí, então, já selecionei por produto, e aí eu vou trabalhar com SH 300610, né? 300610, ok. E você seleciona, e aí você pede para exibir no mapa, né? E aí aparece o mapa, todo o mundo, não é? E aí você tem oportunidades para esse SH em 48 mercados, o mundo está importando 2,7 bi disso, e aí, mas o nosso foco aqui nessa manhã é África. E aí você seleciona a África. Adriano, o que são esses círculos coloridos? Esses círculos coloridos são a classificação das oportunidades, que está aqui nas informações. Quando você clica, você vê a legenda das oportunidades. As oportunidades são divididas em abertura, consolidação, manutenção, recuperação, em declínio e recuperação em risco. Diríamos que as oportunidades elas são como o esforço. Então, as oportunidades de de abertura, muito esforço. De recuperação tem um certo esforço também. As oportunidades de manutenção e consolidação são oportunidades que realmente diminuem um pouco o esforço das empresas a entrarem naquele mercado. Então, as oportunidades para esse SH do 3006 é uma oportunidade de recuperação em declínio. E aí a gente vai ver como que estão os dados desse SH no mercado queniano. Você coloca o mouse em cima do círculo e aí ele abre esse cartão com algumas informações. A classificação da oportunidade, recuperação em declínio, o mercado está demandando desse SH específico 3 milhões de dólares, aproximadamente, um pouco mais, não é? Aí vai descendo no card, mas a gente está mandando muito pouco para lá, né? Muito pouco. Nós temos perdido, né, espaço 6,5% a cada ano, não é? E a gente tem só menos de 2% do mercado queniano. Quem é o concorrente? Quem é o tubarão, né? Quem é o shark naquele mercado? É a China, que tem crescido em média, está crescendo agressivo, tá? Tá crescendo tem crescido 74,5 em média, tá? Mas eles têm apenas 23% do mercado. Então, a China está crescendo agressivamente, a oportunidade é um valor interessante, mas o share, a participação do país ainda é baixa, ok? Dentro do painel de oportunidade, você pode inserir também, você pode clicar em acesso a mercado, que aí você vai ver as tarifas, ok? Para esse produto. Então, a tarifa 0, ok? Então, você pode ver também a tarifa. Então, o mapa de oportunidade ele te dá essa visão da oportunidade do mercado, e aí você também vê como que estão as tarifas ali naquele mercado. Claro que as tarifas provavelmente deva sofrer alguma coisa, mas ainda é muito recente, né, para falar de tarifaço ainda, mas estamos trabalhando, analisando esse impacto em empresas brasileiras e tudo, mas vamos avançando. Então, esse é um exemplo, não é, que nós utilizamos para exemplificar. Então, agora, now I'm going to switch to another code, the 90 in English now, 901849. Okay, let me delete the other one. 901849. Okay, good. So in Kenya, we have an import. So Kenya market is important 1.1 million of this product. Okay. And Brazil has been sent or exporting to Kenya market $24,000 only. We have been we lost market. We've been losing market along the 4 years, 25% per year, right? And we have only 2.2% of the Kenyan market. And the China, again, is the main competitor over there, you know, or down there, yeah. So, and Kenya and China has almost 60% of the market. So these opportunities I used as an example are opportunities that are in recovering, okay, recovering and in decline. So using this tool, right, you can put your code over here. You can type your product over here, and you have this tool start to help you export a little bit more, okay, to any market in the world. The opportunity market tool has 3 versions. One version for the world, that this one we are using, a China version, you know, and in China you can see, you know, states and provinces, and the United States map. So we have 3 versions for it, because in the US you have US states. Okay, as I told you before, the year that the data is available is 2023, because Opportunity Map work with World Trade data. So the World Trade data is closed only for 2023. I believe in November we will have 2024 data version available. You can access this map through the link on the chat that Dantas, you know, probably share with you, and the QR code. You have to do some registration over there, but this tool is free of charge. You can use anytime, you know, to help you exports for the world. And we desire you export more for Kenya market, okay? What else? So you can have access for this product. Let's see the tariffs for Kenya, 0 again, you know, 0 tariff for these products, for this one. Okay, as I told you before, and emphasize, we use HS code over here, not NCM, you know, HS code, 6 characters, you know, and that's it. Other thing, in Africa, on this card on my left over here, you have, you know, 6 countries in Africa, and these countries are important. 61 million of this product, and Brazil is exporting only $832,000 for these markets. Okay, so this is my participation. Was an honor to be here, you know, because, and greetings for Kenyan. I had a great opportunity to visit Kenya for a prospective mission for agriculture implements and auto parts, you know, and we have a great time down there. We have a great support for Kenyan authorities and Brazilian device. I say hello to Johnston Katua, that was the guy that supported us at that time, okay? And have a great day for authorities, for Brazilian embassy, for Brazilian companies, in this way, in direction to the mission in Kenya. And I hope you do great job, great business down there. It's a great country, you know, and I think all of you enjoy, you know, the time down there, and I believe you can do a great job, great business. And we in Apex Brazil, we are available. If you need our support, we are here to help you, you know, to export a little bit more. Okay, have a nice day. Dantas, the words with you.
Thank you,
I
Adriano.
just want to say, thank you, Adriano. We relay the message to Katua.
Okay.
Back to you.
Thank you, Adriano. Thank you for sharing information regarding this tool. For us, it's very important. We all believe it's a great opportunity and great tool for companies who are willing to expand their exportations. Well, to finish our presentations today, I will ask now Ms. Janine Cristina Herrera from Flooding. She's an international trade manager of this company. We invited them to share their experience in the Kenyan market. In the meantime, I ask you all companies who have questions to register them in the chat or maybe on my WhatsApp. When you finish final presentation, we will open the Q&A session. Cristina, please.
Good morning, everybody here in Brazil. Good afternoon for those who are in Nairobi. I will share my presentation.
Cristina, eu estou
you-
na outra tela, não a apresentação.
Just 1 minute. Okay. It's okay now?
Carregando.
It's okay now?
Sim, só colocar na tela cheia.
Okay.
Perfeito.
Okay. First, I want to say thank you to Jose and Abimo for the invitation to share finance experience in the Kenyan market of medical devices. As you say, my name is Gianni Cristina Herrera. I am the International Trade Manager at Fane. And today I will be representing the company in this important webinar. First, I would like to start with a story of innovation. That's the story of Fane. Fane is a Brazilian multinational pioneer in the manufacture of medical and laboratory equipment. The company was founded in 1924 by Arthur Smith, who, with the support of his son Walter Smith, introduced innovative techniques and methodologies, charting a technological road with a high degree of representativeness in the Brazilian health production chain. In July 1954, Fane launched Brazil's first neonatal incubator, revolutionizing the care of high-risk newborns, marking the beginning of a new era of progress in Brazilian neonatology. Founded with this mission to promote neonatal care, in 2004, Fane pioneered a new concept with the Bilitron, the world's first microprocessor controlled phototherapy device with 5 super LED lamps. Today, Fane is a Brazilian leader in the manufacturing of neonatology equipment. It's an important global manufacturer of neonatal equipment. It has delivered more than 300,000 equipments in more than 135 countries around the world. It's a Brazilian company with the highest number of quality system certifications for electromedical equipment in Brazil. And the company has a large investment in research and development. This year, the company completed 101 years in the market. And there is this thing that is countless, and is the lives the equipment has saved. Fane is innovation, pioneering, and cutting-edge training in neonatal care. The industrial park is equipped with modern, high-productivity machinery, ensuring operational efficiency and a rapid response to market demands. The company also believes that the success of its mission to save lives depends on investment in professional training. So for this reason, every year, more than 6,000 people, including nurses, doctors, engineers, technicians, and representatives from Brazil and abroad, receive training. The portfolio of the company is mainly neonatal line and hospital line. It's composed with incubators, transport incubators, phototherapy, hospital and heater cribs, and bubble CPAP. With all of this story of innovation, all of these years in Brazil market, the company has received more than 100 awards in various categories, including export, quality, design, and brand preference, among others. After gaining a presence in Brazil, the company started its journey to global presence. So the first exportations were around the 60s and 70s, and even it was an occasional exportation, cultivate in the company the mindset of always considering the international scenario. And with the support of government actions and associations like ABIMO, the company could participate in different fairs and business missions that helps construct the global presence. In 2010, it was the first Brazilian company to open a factory in India. And in 2011, the company opened an office in Jordan, which is the company's main channel for the Middle East. So continuing with this global presence, was the time for go to Africa. And this was, the company has different reasons for this. And one of them is Brazil is geographically close to the west coast of Africa, which means that the logistic factors will have more frequent, lower cost, and shorter transit time, air and sea. There was other demographic factors that the company studied, and Africa is home to 15% of world's population. Also, find and study maternal and newborn health for the kind of products that we have, and found that in Africa has the highest fertility rates, and it is starting with the urgency to reduce infant mortality rates. And there is this another factor that Brazilians and Africans share the great historical and cultural ties. So with these decisions, in 2004, the company decided to start going to Africa. So Fanning participate in different trade fairs like Africa Health, MedExpo, and MediWest Africa. And by 2008, the company had already delivered products to 7 countries. After 20 years of presence in the continent, Fanning has a consolidated presence in Sub-Saharan Africa. Today, have operations in Kenya through distributor. So already have delivery neonatal incubators, transport incubators, phototherapies, and heated cribs. It was important to have a technical assistance for the distributor, and the country has an install base today. It's also important to construct institutional partnerships, like with public hospital, reference maternity hospitals, and international health programs. It's important to have competitive advantage. So Fanning has reliable technology that is suitable for the local reality. And another important thing is the social impact that the products could have. And this contribute to the improvement of the neonatal health and strengthening of hospital infrastructure. Talking about Kenya, this was an important country for the company because it has universal health systems. Also has the presence of a United Nations office. It's target of international investments, and it's the political and economical center in the region. The country has typical competition with price variation and technical requirements. And to share an experience, in 2012, the company participated for an international public tender in the region to deliver and install 210 transport incubators. The company was competing with companies from Japan, Germany, United States, China, and has the win this tender, has the opportunity to go to the 210 constituent divisions, that is the entire Kenyan territory, and was delivering and installing of these equipments. And today, the company continues to provide support for the correct use and maintenance of the equipment. The trader for this region has the opportunity to visit the country and has some technical and product training for the distributor. Also could have some inspections for the distributor to be sure that all the compliance is they are with the right documents, with the right equipment. Also has the opportunity to visit the distributor locally. Also the fairs and the missions that FANE has participated give the opportunity to have meetings with international organizations. And this fair is always a good opportunity to connect with not only distributors, but other organizations in the country. So this is what I want to share today. Obrigada, and thank you, everybody. If you want to know more about FANE, you can visit our website and also follow us in social media as FANEBR. And if you want to contact the exportation team, here is the email and also my email if you want to have more information. Thank you.
Thank you, Christina. Well, FANE, it's a well-known company in Brazil. You guys have 100 years of experience in Brazilian market, and it's a reference for all of us in terms of exportation. So thank you again for accepting our invitation and for sharing information and your experience in the Kenyan market. Thank you. We'll now open the Q&A sessions. I already have some questions here. Once again, I would like to ask companies to register their questions in the chat, or if you want to talk, you just open your mic and we will start. I will start one for the embassy. I already have here the question. The embassy in Nairobi deals with other countries also, so maybe you can explain to the Brazilian companies which are those countries who these Brazilian companies can ask for information, data, which are the countries that the embassy in Nairobi deals with.
Opa, obrigado, José. Aí, deixa eu ligar minha câmera. E aí?
Yes.
Então, nossa embaixada, além do Quênia, ela acumula também a jurisdição sobre Burundi, Somália e Uganda. Até recentemente nós tínhamos Ruanda também, mas Ruanda recentemente nós abrimos uma embaixada residente. Então agora nós temos uma embaixada em Kigali. Mas para Burundi, Uganda e Somália, nós continuamos mantendo nossas relações a partir de Nairobi. Então, para todos aqueles serviços que o Brian citou antes, né, de facilitação de informações sobre acesso ao mercado, eventual contato com distribuidores aqui no país, etc., nós podemos facilitar.
Perfeito, obrigado, Guilherme. I have one question here for George from the Ministry of Health. As you said on your presentation, Kenya is committed to achieving universal health coverage by 2030. Is there any target from the government in terms of quantity of new health units? Is there any plans to build new hospitals? How the government is dealing with this? Can you share some insights about it, please? I don't know, George, are you listening? Your mic is open, but we cannot hear you. George, can you hear us? I see that you open your mic, but we can hear you. Yeah, your camera is on. I think now it's working. Just unmute your mic and I think you will be able to talk. If it's not working, don't worry. You can write on the chat. The question again is just regarding the target for new hospitals in Kenya, if you have any plans to do it. I see that you were talking, but your mic is off. Let's move on for the next question, and maybe we can go back with George. For the PBB, Eric and Dr. Allen, this one is for you. Once you have completed your registration process, for how long your registration is valid in Kenya?
Oh, okay. Thank you very much for the question. Your registration will be valid for 5 years, but you'll be required to retain the product annually. So there is just annual retention, but registration is valid for 5 years. After 5 years, you will do what we call a re-registration of the product, because there might be so many changes within a 5-year span period that needs to be updated. Thank you, and over.
Perfect. And Dr. Holland, on your presentation, you said companies can ask for permissions to participate in exhibitions. So there's a question related to this. Are there any requirements or fees to bring a suitcase with products that will be displayed on the exhibition in Nairobi next October? The company will be carrying them with her in their luggage, and would like to understand the procedure. So maybe you explain how companies can ask for this permission.
Thank you very much. Good. Now I can see. Yeah, thank you very much for that good question. Yes, we allow promotional material for exhibition. And in as much as you're bringing them through using a briefcase, it is important to get a permit for it. And we have provided that functionality there. There is a permit, promotional material permit, which addresses material which have been brought for training to healthcare workers and materials which are coming for exhibition. The process is that you do a letter to the CEO of the Pharmacy and Poisons Board, indicating that you are bringing this quantity of medical devices, this device and this quantity, and they are coming for this exhibition in this particular place, and your stand or your where you've been assigned to do your exhibition is this number, and therefore with that letter you will attach your invoice of the same with the value that will be declared for custom purposes. And now that that invitation to exhibit from the exhibitor. So if it is the World Day of the exhibition happening in Nairobi in October, they will have that invitation to you. You'll have the letter to our CEO and their invoice. So that is what we will use. And remember, Customs Authority will also give you an equal letter based on your application to them. So that now with that one, we put it together and you put it in our permit and we give you a permit to import it. And it's a free permit. We don't charge you for it because you're not bringing for commercial purposes. But we just want to also protect the market that in case during exhibition somebody is interested in buying, then you will need to alert us so that now you begin the entire process of registration as Eric has indicated. But in case then you don't have to, there's no buyer of it, maybe the arrangement is for later, we will give you another permit to take back the goods from the country of supply. Thank you.
Perfect. This letter addressed to the CEO of PBB, it must be sent earlier the show or just bring them with the company and presented this to customs?
It should be done earlier because we need to give you the permit for promotional material before you come, so that when you come, if you're coming in the briefcase, the customs official will not detain your briefcase or it will not detain your product. So we have to give you earlier. So what happens currently is, if you know very well you're having that exhibition happening in October, then between now and end of September, you need to have appointed a local technical representative who will do the local running for you. And just ensure then that all the documentations are in place. Alternatively, you can liaise with the embassy to also give you that facilitation. Thank you.
Perfect. Maybe you can share the email address where companies can send the letter and submit their application.
Thank you. I will send to our colleagues in the embassy, and then they can share with you. Yeah.
Sure, and we can take it with them. Thank you. Well, I see here another question from Alexandre, but it's already been answered. But just for you to know, if you are wondering if your device is qualified as medical devices or not, Mr. Eric attached a guideline so you can check informations there. And the answer from the Ministry of Health, from my early question, yes, the government has started to implement the universal health care. It was envisioned to have been fully implemented by 2030 via the Kenya Vision 2030 blueprint. So, well, we have 5 years left for this project, so we will see some development in healthcare services in Kenya. Well, this is another reason why Kenya is a very important market for us, and we should focus our attention there. Well, let's see if there is any other questions. Well, by 2030, the ministry expects to have about 5,000 new facilities, making about a total of 2,000 facilities in the country. So yeah, it will be a very great opportunity to have more resilient products entering the Kenyan market. I will share information with the companies again about procurements and tender bids, just to make sure everyone has the opportunity to see these well, commercial opportunities to sell and export to Kenya. Thank you again, Mr. George. And just to end the questions I received, this one is again addressed to the embassy. With this upcoming event in October, the embassy has any guidelines in terms of visitors, advices, information they have to, well, to know before they come to Kenya. We know that we Brazilians we have to well, fill in ETA, it's electronic travel authorization. But is there any other thing the companies here watching our webinar must be aware?
We have a guide that we are updating currently for visitors here in Kenya. We should be sharing them with Abimo, so we can forward it to the attending companies shortly. The main thing is the ETA, the electronic travel authorization. They have to request online. It's usually granted pretty fast, like 3 days. Most of them seem granted the same day. And the other thing that I would pay attention to is the requirements to bring a medical equipment to exhibit that we already discussed here earlier. But we're finalizing the guide. We'll have some important information such as the consular phone number in case of emergencies, hotel suggestions, and other information about the currency payment systems here in Kenya, and just general information for any visitors here.
Thank you, Guilherme.
Maybe Guilherme, if I may add something, is
yeah, please, Nelson.
yeah, the concern around Uber also for local transport, for local travel. It works more or less as it works in Brazil, so you don't have to worry about airport transfer. Uber works the same way. So once you get in here, you can
Uber works
utilize the
pretty well here.
Uber application for your local travel. Thank you.
Thank you, Nelson. So we will be waiting for this information. Well, I didn't receive any other questions, so I believe it's all done for the companies. Once again, I would like to thank the embassy for the partnership. As we said before, the upcoming event in October, the World Health Expo Nairobi, we will be participating alongside the embassy. It was, well, a great opportunity for us to be there again. It will be. Thank you again, the Ministry of Health, the Pharmacy and Poison Board, Apex Brazil, and Funding for accepting the invitation. The World Health Expo Nairobi, it's organized alongside the Ministry of Health. So we would like to take this opportunity to invite all the Kenyan authorities to visit the Brazilian pavilion. We will have 4 industries exhibiting products there. Of course, the other companies that are already in the Kenyan market will be present also, but with their distributors. We would like once again to thank the companies who are watching here the webinar. As I said before, the video and the presentations will be shared with you as just we finish here the webinar. Thank you again. Guilherme, if you want to do your final remarks.
Thank you, Jose. Thank you for this opportunity. I want to thank everyone here for attending, especially the Kenyan authorities, the ones we invited here to the embassy, the Pharmacy and Poisons Board, the Ministry of Health. Thank you so much for participating. I'm sure this was a very valuable presentation, and there was a lot of information here for the Brazilian companies that wish to enter the Kenyan market. And thank you a lot for Abimo, thank a lot to Phanem, to Apex, to help make this even a more rich webinar. And we have our contact. I know it was at the end of the presentation, the email to our trade promotion sector here, Secom. And any questions, any doubts, or anything else not necessarily related to what was spoken here today can be sent to the email, and we'll be sure to answer it and help in whatever way you can.
Well, thank you all. See you next time with the next edition of our series of Trade Access. Have a good day, everyone. Thank you.
Thank you. You too have a good one.
Thank you. Good day.
Bye-bye.
Bye.
Bye-bye.